So what do you call yourself? Welcome to the LaTangela Show. Hey.
Hey, what can I do for you this fine day?
This is your destiny. Hot, hot, hot. Right now.
Welcome to the LaTangela Show.
Kick it.
Come on in and enjoy yourself.
Right now.
We gon' party like no one else. Welcome to the LaTangela Show.
All right, now I have questions that need answers. Are you ready?
I am ready as well as I can be.
And welcome to another episode of the LaTangela Show podcast. You know, it does my heart well to have this time together, especially when I get the best of the best in the hot seat and on the tan line. I knew he was coming prepared and that woman's logo would be somewhere close, so I just wanted to show off my woman's cup. You see that, right? Got there from the open house from your wonderful team. And, you know, Dr. Hallner, you are no stranger to the world of healing and making sure that everyone is getting the information that they need. Tell me a little bit about your position as the medical director, I'm gonna get this right, of Urogynecology Program at Women's Hospital.
Yeah, so urogynecology, as the director, I've been fortunate enough to start a service line here at Women's Hospital to where we treat pelvic floor disorders specifically tailored to women who have either prolapse or urinary incontinence or pelvic floor dysfunction. Now, in addition to the service line that we offer here, I also teach at the residency program, and I'm providing care to patients that they see, but also educating our future providers in this field.
I love it. And you know, this is a very sensitive topic. You hear all of the advertisements, you may hear the names in passing, but you don't really hear about people just sharing their stories or it come up in regular conversations. So tell me a little bit about the things that come across your desk. At what point do we know that we need to come see you?
Yes, so that's a really interesting question because the topics in the field that I deal with are really embarrassing. So women don't necessarily talk about these types of problems in general. They may not even speak to their spouses about it, their sisters about it, or even their moms about it. And there was some social taboo about problems in this field. And this would be things like prolapse, something falling out or bulge in the vagina, where your female organs are dropping through the vaginal opening, but also urinary incontinence, where you would leak that involuntary aspect of leakage, whether it's on the way to the bathroom or when you sneeze and cough. But that also involves fecal leakage, so having stooling accidents that are uncontrollable. And these are the topics that I see day in and day out. There's a host of other things that I do see with pelvic floor dysfunction, pelvic pain, abnormalities or formation issues that women may develop after surgery or after having birth regarding lacerations or even fistulas. So there's a whole host of different topics that I do see, you know.
Right. And when you're seeing these different ranges of issues, people may not want to talk about it. Do you feel as if there are certain warning signs or certain things that should be triggers for us to say, well, I might need to book this appointment now before things just kind of spiral and it gets to the, you know?
Yeah, so it's going to start off and it's going to gradually increase over the years. So this may be pressure in the vagina. This may be a bulge. You know, many women will notice something when they're showering and they're kind of cleaning in the vaginal area. They may feel a bulge. They may feel a lump. All right. Or, and that's just related to prolapse, but then urinary incontinence. If they're getting those urges to go to the bathroom and the urine is leaking out before they get there, that's another one. Or when they sneeze, they cough, they laugh, they giggle, and they're leaking urine. Yeah, so these are some of the most common symptoms that women with prolapse or urinary incontinence or that involuntary leakage of urine may suffer from.
Right. Is there a certain age range that you see with this mainly, or is there a certain age range that we should start looking for signs?
Well, I mean, it can gradually start in younger women. Women who have had a baby or two may start to develop urinary leakage. But we know from studies that 50% of women 65 and older will have either loss of urine involuntarily, and most women will have some degree of prolapse. It's just whether or not it's symptomatic or not. So women can have prolapse, but not be bothered by it. And there's nothing they really have to do about it. If they're not aware of it and they're not bothered by it, that's really not going to heighten any kind of awareness, right? But if they're having bothersome leakage or leakage that affects their quality of life, these are the topics they should be bringing up to their either their primary care doctor or their gynecologist. And those are typically the patients that I get sent when they report that. Now, from a medical standpoint, these are questions because it's so common that the primary care doctor should be asking. Do you have a bulge in the vagina? Are you leaking any urine? Is it bothersome to you? And especially gynecologists, many times, if the patient doesn't bring it up, providers will assume it's not bothered or not, it's not a bothersome problem.
Right. And for urinary incontinence, we hear about that one because I feel like that's the one that they advertise the treatments or wraparound services for the most, right? What are some of the things that are warning signs or treatments or things that families might be able to say, okay, it's one of those things, but we can either prevent it or make it more comfortable for whomsoever may be, experiencing that.
Yeah, so it really comes down to quality of life. All right. So just because you have leakage doesn't mean you have to do anything about it. It comes down to an issue is when it becomes an impact or a negative impact to your quality of life. Because as I kind of allude to, I'm in the quality of life business. My job is to try to improve someone's quality of life, give them back their dignity without making things worse. So from a urinary incontinence standpoint, if you constantly know where every single bathroom is, if you can't go a single place without going to the bathroom first or leaving the going to the bathroom before you leave, right? That's having an impact into your quality of life. There are treatment options from physical therapy, behavior modifications, watching what you drink, when you drink, how much you drink, all the way to medication options and surgical interventions that many of them are minimally invasive. It doesn't have to put you down for a long time. And it just kind of depends on how much this negatively impacts your quality of life. And I basically started from the beginning. We're going to work on some behavior modifications. We're going to possibly incorporate some pelvic floor physical therapy. There may be the addition of a medication or two here or there. And for the ones that really don't respond to any of those, we have minimally invasive treatment options such as injecting Botox in the bladder. And then we can even go so far as electrically stimulate the bladder to kind of help either empty it or control and reduce leakage. So it really just varies from person to person. And I try to tailor make their treatment algorithm to that specific patient, because what might work for one may not necessarily work for another.
Right. It's so important that we open a line of communication because many may not even be aware of options. They may not be aware of symptoms. They may not be aware of, this is something that's not normal. So they may not want to open their mouths to even say it. I was reading a little bit about what you call pelvic organ prolapse. What are some of the things that might even bring that on? Is that just something that happens? Is there something that triggers it? Is it a time situation?
So it's a little bit of everything, right? So we've referred to pelvic organ prolapse that it's multifactorial, meaning there are just more than one component that has led to that. And that can be everything from childbirth, traumatic childbirth, age, menopause, and then there's other factors that contribute to it, like chronic constipation, obesity, things, or even some patients will have jobs that require them to do heavy lifting. So that straining can help drop things down. But one of the things I want to go back, because you kind of touched on something about, we don't talk about it. Because in general, as society, we have normalized women that it is okay to leak. It is okay for things to fall out of the vagina, that this is normal. This is what happens. And it doesn't have to be. They don't have to suffer with these disorders because there are treatment options for them out there.
Absolutely. And I know Women's Hospital, they're always a trusted source, tested, tried, proven. And then with hearts like yours, that's willing to take the time to still educate while in the midst of caring for so many patients. Here in the state of Louisiana, we know that healthcare is always going to be top tier of concerns, but knowing that we have a safe place in women's and with, the physicians such as yourself, this is very important.
Yeah,
Um,
this is truly a passion of mine, and I didn't mean to cut you off there, but this is truly a passion of mine. And what I try to do is I try to make the topics that are really uncomfortable comfortable. I want to make it easy for my patients to actually talk to me about these disorders and make it feel that I'm listening, I hear them, I have the compassion and the empathy, and I'm here to try to help them restore that dignity and give them back that quality of life. And we
you
do
mentioned
that
that.
here at Woman's,
But,
so.
out of all the levels of concentration that you could have chosen, what led you here? I love a good story behind the story.
Yeah.
Like how did you know that this was your calling?
You know, it's a really interesting story because when I went to med school, I actually was not even considering, I would say OBGYN was not necessarily even on my radar. I ended up as in my third year, my last rotation of my third year in medical school. I had a wonderful experience during my OBGYN residency, rotation. And I fell in love with the field. I fell in love with taking care of women. I was fortunate enough, I did my residency at LSU in New Orleans. And in my second year, one of the upper level residents was out and they needed a resident to fill in for the urogynecologist who was there, called Dr. Chesson, right? And so I had the opportunity to work with him, and he had such a passion for it that it just kind of left a mark on when I saw these patients, and especially after we did surgeries to correct and improve their quality of life. When they came back, they were so happy. Their quality of life was restored. Their dignity was restored. Their body self-image was restored. And that just left an impression. And I was like, this is what I want to be a part of. And I had I did my fellowship training at LSU. I had some wonderful mentors, and their passion it made me love the field even more. You
I
know?
love that. I
Yeah.
love it.
Yeah.
And it shows. And it's very important that when patients come to a physician, we're already scared. We already don't know. We don't know what questions to ask. We don't want to sound stupid for asking the question. So it's important that whomsoever is on the other end of these life-changing decisions and options have a passion for what they're doing.
I spend half my time when I see a patient truly educating and explaining to them what the disorder is, because I firmly believe that if they understand what it is and what the options are, why we may choose a certain path over another based on their problem, right? And so by educating and teaching them, they may choose to do one thing or another. Many patients come to me, they are already been told, you have to have surgery, you have to do this. And when I see them and I evaluate the impact into their quality of life, many of them, they're not terribly bothered. They have the disorder. We educate them, we teach them, show them all the options about it. And many of them say, I'm great. This is the wealth of information that they got empowers them, that now they have choices and they don't have to see it's only surgery. They have all these other options in between, and we can flip flop from one to another.
That's good. Very good. I know that you mentioned a little bit about pelvic floor dysfunction, but in real time, behind that title, what does that look like on average for someone's day to day?
Yeah, so for many women, it's kind of a catchphrase. So when we talk about the pelvic floor having dysfunction, that may include urinary incontinence, that involuntary leakage of urine, whether it's with urge or activity, sneeze, cough, or even intercourse, right? Fecal leaking stool, whether it's involuntary or not. But then also pelvic organ prolapse. But then other women can have where their pelvic floor doesn't relax. They may suffer with painful intercourse. They may have pain in the pelvic area. They may have vaginismus where the vagina has spasms. So it's kind of a catchphrase for a multitude of different disorders.
It's very important that we're having these conversations and just to normalize it because so many people may be having symptoms and have absolutely no idea what it's linked to, what it's caused, or what type of treatments that could be available. I know talking to our physicians and making sure that we're talking to them and having a good relationship before we get to the specialist is important. But what would be some of those preventative methods that you would recommend?
Yeah, so that's the challenge. There's truly never been any big time studies to suggest what is the preventive phase to how do we prevent this, right? So a lot of the gynecologists or even the physical therapists will say, do your Kegels, right? That may help it, but we're really not going to necessarily be able to prevent it per se.
Mhm.
But there are strategies that we can work to try to hopefully keep it from getting worse, right? So doing pelvic floor physical therapy, watching how we're managing our chronic constipation or chronic straining, these are, or that heavy weightlifting, these are things that can contribute to it, but it's also not suffering with it for so long before you do something about it. When I see patients, the vast majority of them may have been suffering from a disorder, whether it's prolapse or incontinence, for anywhere from 5 to 7 years on average. But I have some women, 20 years, 30 years, they've been suffering from this, just not knowing there was options out there. And when they find that out, many of them will come back to me, depending on what we did, and say how life-changing this was. Why didn't I do this earlier, right? Because once again, somehow we have normalized it's okay for women to leak. It's okay for when things to fall out of the vagina. And it's not the case. But from a medical practice side, the providers, we should be asking our patients, do you leak? Do you have anything falling out? Do you have pressure in the vagina? Right? And those are the questions. And then, from the patient standpoint, saying, I have this problem, is there anything that can be done? Is there someone I can see? From my practice, most of the patients that I see have been referred to me from
Okay.
either primary care, family medicine, gynecology. They have seen their patient and they've either been asked the questions or they've brought it up to their provider that this is an issue, and then they've referred them to me. And then I kind of take the ball and I run with it from there.
I love that. I know my mom is going to watch this interview and say, see, I told you, you can't be picking up on heavy stuff. So it's always something that a mom will say, but now you just justified half of all of why they say what they say. It's
Yeah.
usually because so many women will do things out of habit or out of convenience in that moment. And we're playing superwoman. We have on these capes and we're not understanding that we could be impacting our bodies and causing damage without even knowing it.
Yeah. And really what I would say is I want women to be active. I want them to work out. I want them to do all the things that they want to do. These are just factors that can lead to prolapse, so, I don't want them to stop lifting anything, but that you, Karen,
Balance it out. So,
I lost the way that I was going to go. I apologize for that.
I
But
understand.
yeah. So I want them to be active. I want them to be engaging in physical activity. I don't want them to be sedentary because that's just as bad as well, right?
Yes.
And so, and it's really prolapse and incontinence is so it's so dynamic in some patients. I have women that have never had intercourse. They've never had a child. They've never had a hysterectomy, and they suffer with prolapse because there's genetic components, there's age-related changes, menopausal related changes that can contribute to it. But then you can have others, they've had 3, 4, 5 babies and they don't leak and they don't have prolapse, and that's just kind of why it's multifactorial in that context, that not everybody will suffer from it. Some will.
Well, one great thing about Women's Hospital is that you all have services and wraparound programs and so many different options, and we appreciate you for that. I know this is your first field trip to the madhouse, but just promise it will not be your last.
I hope not.
Good. I am holding you to it. Now, for more details, I want everyone to feel free to log on to womans.org. Make sure that you're having these conversations with your physicians. And if you need a specialist, well, Dr. Hallner, he is there. And I appreciate you. I know you have more work to do. So I'm going to let you chase the sun or let the sun chase you. But either way, get after it. I love you. And there's absolutely nothing you can do about it.
Sounds great. I'll take it. I'll embrace that. And here at Women's, we provide high quality, compassionate care for all of our patients.